Hi friends, I'm Dr. Marta Perez and welcome back to my channel. I'm an OB-GYN and we discuss everything about pregnancy, birth, postpartum, reproductive health. Every Friday, new episodes. Be sure to subscribe. Today's a fun episode. It's 5 weird pregnancy symptoms and why they happen. Let's get started. Okay, a really popular question I get in prenatal care is questions about strange symptoms. Is this normal for pregnancy or is this not? And so I rounded up some of the ones that I find the most interesting or the most common and go over them. And maybe you'll have some of these symptoms, but maybe you won't. The really interesting thing about pregnancy is that not only is each person's body different in how it responds to pregnancy and what symptoms they have, but also a lot of people have different experiences in different pregnancies. I see this a lot with like nausea and vomiting in the first trimester or morning sickness. Some pregnancies it's really bad and other pregnancies is not as bad. So something to keep in mind is you may or may not have experienced this in a pregnancy you are in now or already had, but you might experience it in the future. Let's get started. My first one is a change in the taste of things. The scientific and medical term for that is dyschezia, and it basically means that tastes are changed. So something I hear a lot is that people love coffee and then all of a sudden the taste of coffee is disgusting. The other thing I hear is that people feel like they have a metallic taste in their mouths constantly. And I noticed that these symptoms for most patients tend to be the worst in the first trimester, and they sometimes do and sometimes don't get better for the rest of pregnancy. Why does this happen? Well, we don't have an exact scientific mechanism, but it's really believed to be the effects of hormones. Hormones affect not just like our reproductive system, but they affect things all over our body, including our taste buds and the content of our saliva. So that's probably the explanation. This is a pretty mild symptom overall, but it can be pretty bothersome to certain people when all of a sudden your favorite food or a food you eat really commonly is really gross. Okay, the second one is called restless leg syndrome. Now you may or may not have heard of restless leg syndrome before. Basically, restless leg syndrome is a condition where a person feels the urge to move their legs, sometimes arms, at night when they're in bed resting. And when they move, that uncomfortable urge kind of goes away, but it can come right back. This can be really bothersome because if you have these urges, like every 1 to 2 minutes, it can really impact sleep because it can last for hours, leaving someone unable to sleep, unable to release their mind from that. Pregnancy is a risk factor actually for having an elevated risk of having restless leg syndrome. Interestingly, restless leg syndrome is actually associated with having iron deficiency anemia. So if you feel like you're having these symptoms in pregnancy, talk to your OB-GYN or midwife. The first step is to test for iron deficiency anemia. You actually don't test the iron amount total, you test for ferritin. If ferritin is high, it means your iron levels are low and you should be supplemented with iron, which can be done either orally by taking iron pills or done with an IV iron infusion. So that's the first thing to do. Now, some people might have restless leg and they don't have iron deficiency and they might find that iron supplementation doesn't help them. There are some other treatment strategies out there, but I'm not gonna go into all of them. So talk to your provider about that if that is what's happening with you. Okay, the next syndrome is called pica. Pica is fascinating, and we see pica in a lot of pop culture. When you know what it is, you'll start picking up on it, not only maybe in TV shows and movies, but also maybe in friends and family. I recently watched the show The Great on Hulu, which is about Catherine the Great, and in one of the episodes during her pregnancy, she's eating soil from the ground. That's an example of pica. Pica means eating anything that's a non-food item, having the urge to eat non-food items. The most common one is the overwhelming urge to chew ice, right? We see that a lot. Soil or dirt is another one. Some people, it's chalk or sand. And then there's another one, which actually I see a lot, which is the urge to eat cornstarch. So those are all really common manifestations, but it's other things too. Pica is also associated with iron deficiency in pregnancy and anemia. So the very first line therapy should be trying to address the anemia, which might relieve the symptoms of the pica. It can also be associated with other nutritional micronutrient abnormalities, and it can worsen them as well, because when you're eating things like baking soda or dirt, those substances can actually bind up some of the nutrients in our gut and make them not available for our bodies in some ways. I have really honestly never seen it be so severe that someone gets really sick from this. The fourth one isn't necessarily weird, but I find that a lot of people don't expect it, and that's getting cavities and needing dental work in pregnancy. I have tons of patients who have their first time needing a root canal, having a cavity, having a tooth abscess, and a lot of pain when they're in pregnancy. And this is really common. Pregnancy increases the risk of having periodontal disease and gingivitis, cavities, and demineralization of teeth. And this is for a lot of different reasons. Some of them are like hormonal, related to contents of saliva that change during pregnancy and make you more at risk. Other things that are related are nutritional deficiencies. A big risk factor for this is not getting routine dental care. Before pregnancy and when you are pregnant, you should absolutely be getting your twice a year dental care and cleanings to help prevent and address this. Dental cleanings and dental work is safe during pregnancy, especially a routine dental cleaning. You should not need a note from your OB or midwife. If you do, we're happy to provide it. But if you're declined routine dental care, that's a warning sign that dentist maybe isn't up to date on what's recommended, because it is recommended in pregnancy. Maybe find another dentist. If you need an invasive procedure, overwhelmingly most of that is safe and recommended in pregnancy as well. Okay. I saved my favorite one for last because I don't really have an explanation for it. People commonly have heard about postpartum hair loss. That's something that's pretty well talked about in society. I do have a video on postpartum symptoms. I'll link it above in the corner so you can click it. But interestingly, I have some patients tell me that while they're pregnant, they don't have as much hair growth like on their legs. Like, for example, they have to shave their legs less. And I don't particularly have an explanation for that. I know that hair follicles undergo normal cycles. So your hair grows and then it finishes growing and it stays and then it releases. And during pregnancy, the reason we have postpartum hair loss is because during pregnancy, your body holds on to the hair instead of going through the normal cycle of letting it go. And then about 3-ish months postpartum, it's like your body remembers that they're supposed to let that hair go, and that's what's responsible for a lot of that postpartum hair loss. It's a normal process. But I don't have an explanation why some people say, I don't have to shave my legs as often during pregnancy. But that's probably one of my favorite weird symptoms, because that sounds nice, right? Less shaving, less hair, not on your head, but everywhere else. All right, guys, I hope that was fun and informative. Please subscribe to my channel so you can stay up to date on all evidence-based pregnancy, birth, and postpartum updates. If you have a recommendation for an episode, please drop it below in the comments. You can follow me on Instagram at Dr. Marta Perez, and thank you so much for joining me. I'll see you next week.